afternoon. My name is Sarah Wheaton. I'm the Chief Policy Correspondent at Politico, and you are watching Politico Live. I'm coming to you from the Residence Palace here in Brussels, where we're just 2 days away from the Africa-EU Summit. So, the name of this event is the global response to the COVID-19 pandemic, Hope or Disillusion. And someone asked during one of the prep calls for this event, which is it, hope or disillusion? Well, up to this point, about 12% of Africans have been vaccinated compared to 71% of Europeans. And over here, we're starting to talk about fourth doses, so there's some disillusion for sure. But is there reason to hope? And what would that hope look like? Is it hope for better cooperation next time around? Is it hope that Africa will do better on its own without help from the global north when, God forbid, the next deadly bug comes for us? And hey, let's not forget about the hopes of China that they might be able to take advantage of this breach in the relationship between Europe and Africa. We will be discussing this and more with our panelists. But first things first, a few housekeeping remarks. I'd like to thank our partner One for making this event possible, and thanks to those of you joining us online. We always like to make our events as interactive as possible. You can participate by tweeting about it at @LivePolitico and ask questions via Slido using the hashtag #ResponseForPandemic. That's with the number 4. And I'll be prioritizing questions that come with a name and an organization so that it's transparent for our viewers and panelists. You can already share your thoughts and answer the following poll presented by One. Who is responsible to ensure low-income countries have enough vaccines for their citizens? We'll look at the results at the end of our panel discussion. Before we get started, we'll now hear some opening remarks from our partner One and Gail Smith, One's CEO.
Thank you very much, Sarah, and hi, everybody. We're delighted to be doing this with Politico, and I say that as an avid daily reader. Look, I think this question of hope and disillusionment, let's look at where we are. We're at the point now where many wealthy countries are concluding that they can live with the virus. They've got high vaccination coverage, more vaccines available, and new and exciting therapeutics. At the same time, we've got a lot of low-income countries concluding that they have no choice but to live with the virus because they're still undercovered and don't have the access to vaccines and therapeutics that we need. We at One look at summits as action-forcing events, and this EU-AU summit is critical. President Biden's upcoming summit will be, as will be the G7 and G20. But the question is, what will be decided at these meetings? First, will there be a decision to build on the fact that Africa, although it has the lowest rate of vaccination coverage in the world, has done the most of any region to marshal the political capital and collective action needed to build a supply chain, buy its own vaccines, man the African Centers for Disease Control, and build a plan and a strategy to produce its own medical supplies. Second, will we get therapeutics right? These are really exciting scientific discoveries. Can we learn any lessons from what we've done wrong with the vaccines to make sure that we don't adopt the sort of business as usual approach at a time that is highly unusual? Third, are we going to look at down the road a global economic recovery or a divergent recovery? We all know that this pandemic has hit everyone hard, but no one harder than the people who live in low and low middle income countries. Will we move forward with progress on special drawing rights and a genuinely global recovery? Finally, we're still at a point where we need vaccines and more vaccines to move, but in a comprehensive way. Will we match vaccines with delivery, with the diagnostics and other tools that are needed? I'm hopeful. I'm disillusioned and a bit angry, to be frank, but I think we've got these opportunities to get it right. And let's all hope that year 3 is the year that this pandemic ends. Sarah, let me toss it back to you. And thank you, everybody, for joining us.
Thank you, Gail. And thank you to our panelists. We are going to kick it over to you. Gail was frank. I'd like to focus on the future for much of this event, but first I want to have an equally frank kind of assessment of where we are. I'd like to hear your takes on what the state of coordination on this pandemic has been between Africa and Europe. And so, John Nkengasong, you're the director of the African Centers for Disease Control and Prevention. I want to start with you from where you're sitting in Addis Ababa, Ethiopia, the seat of the African Union. How is that coordination going? I think we can't hear you.
Okay, good. You can hear me now, I'm sure.
Yes. Yes.
Thank you for for inviting me to be part of this conversation. I think there's yesterday, I believe, was February 14, which marks exactly 2 years since the continent reported the first cases of COVID-19 in Egypt. And it is fair to say that it has seen a continent at its best in terms of the ability to cooperate and ability to express solidarity. And that symbol of cooperation and solidarity has enabled the continent to be better organized than ever. I've been in HIV or in public health for 32 years, and I don't recall any moment that the continent was this coordinated and organized. And it is also fair to say that it has been a remarkable political leadership that has enabled the continent to come together as one under several platforms. And because of that, there are about 12 different initiatives that have been delivered because of the ability, out of necessity, including the ability to coordinate the continent to acquire vaccines, through different partnerships and many other initiatives that time would not permit me go into. But suffice to say that the power of regionalism has prevailed on the continent, and there are many lessons that have been delivered that we absolutely need to build on for a better Africa that has its own health sovereignty at the heart of the ability for all of us to build a global health security architecture. A global health security architecture that says that we will not get there unless the regions are better organized and supported to deliver on the promise. We also have to recognize that we all are for multilateralism, but that it has expressed the limits of optimism and that we need to hit the reset button that says that a pathway for global health security is the ability for the continent to have its own health sovereignty in the areas of vaccine manufacturing, diagnostics, pharmaceutical, and workforce development, and strengthening overall institutions there. If we do that, the continent gets its own sovereignty, but then everybody benefits. I will just conclude by saying that a threat anywhere in the world with respect to these emerging infectious diseases is a threat everywhere in the world. Thank you.
Thank you, John. Indeed, we heard European Commission President Ursula von der Leyen say at the beginning, and she was certainly not the only one to say it, that no one is safe until everyone is safe. Lieve Fransen, you are a global public health advisor. You used to work in the Commission helping to build their strategy to fight HIV abroad. You're now working in Europe, Africa, and India with public health efforts there. What did you see during the pandemic? Did you see that kind of no one is safe until everyone is safe ethos play out?
Well, good afternoon, everybody. I'm very happy you organized this event, and very timely just before the African EU partnership is under discussion and the summit is taking place. So it's very timely, and I hope it still can influence also the decisions. What I see, I mean, I like the title of your event because I'm really disillusioned. And when I talk to my partners and colleagues across the world, most of the people are also very disillusioned that 2 years after the pandemic started, and with all the lessons we learned from Ebola, we learned from MERS, we learned from AIDS, we have not done really much better. But I'm also full of hope that this summit will make the difference, and that we finally will listen to each other and get into the emergency mode that we should have gotten into 2 years ago. Because an epidemic or pandemic is an emergency, and negotiations for years, business as usual for years doesn't work in an emergency. And we are all in this together with the virus, and we should be also all together with the response. The response has not been strong enough, not right enough, not equal enough, and I hope that we can discuss some of that. In the beginning of the epidemic in March 2020, I already proposed to the Commission and to the partners in South Africa that we should make a difference here. Something that we didn't solve when 20 years ago, when we created and when I was the part of the architecture of the creation of the Global Fund, we didn't think enough on manufacturing and localization of manufacturing. At that stage, it was understood that it was not possible in Africa. They even said it was not possible in India. In the meantime, India has become the biggest producer of pharmaceutical products. And I thought the reasoning that I had is that manufacturing and localization of manufacturing was needed because Africa basically only produced 1% of their products they need, or the vaccines they need at that stage. And it's only increasing very slowly. It should have increased much faster. But also because I believe that at that stage, we knew already that this time we should do things different because the whole world needed to have treatments, vaccine, diagnostics at the same time. And the capacities worldwide were not there, not only not in Africa, but globally. So we should have increased the capacities very quickly at that stage. If we had done this, and if we had really taken that seriously 2 years ago, we would have been in a different position. I'm very happy now that the Commission is taking this forward. I'm even more impressed by the program and the strategy that was developed since 2021 extensively by the African Union for manufacturing of localization of products in Africa. And I hope that these two, the European response, really respond to the expectations, the ambitions, and the very good coordinated preparations of the African Union and the African CDC on localization of products. We need to do different. One thing that I would like to mention here also, when I look at the figures, I really think that we have 6 million people dead for the moment, and probably more. We have also 200,000 healthcare workers died. We only have 1 in 5 healthcare workers in Africa that are vaccinated. Could we have not done better at least to vaccinate quickly all of the people that are in the front line, when we know that we already have millions missing, a gap of millions of missing people in healthcare workers, as healthcare workers in these regions, especially in Africa. Okay, I'm going to keep it here.
All right. Thank you, Leva. Since you brought earlier in your statement, you brought up manufacturing. So Stavros Nicolaou, you're the senior executive for strategic trade at Aspen Pharmacare, which is based in South Africa. What would you have liked to see to help you be able to provide for people in the region?
Firstly, thanks very much for having myself and Aspen in this very important discussion. Let me preface what I'm going to say by pointing out, I think, what is a very obvious but a very important statement. And that is, one of the biggest learnings over the past 24 months has been that local capacity solve local problems. I think we were all slightly buoyant at the onset of the pandemic when the world spoke about solidarity and that we kind of look after each other. We've all expressed, or all the previous speakers have certainly expressed, that the contrary has been proven to be true. And you cannot plan for pandemics at the onset of a pandemic. You have to plan between pandemics. So local capacity is what solves local problems. And we can never leave to chance again the fact that there are very few local capabilities and capacities on the African continent. So those are just my prefacing remarks. Let me move on to the question you've asked me directly, which is, what do we need to do? I think the most important thing in any manufacturing consideration is that you require economies of scale to keep these capacities sustainable and productive. Where do these products get procured? They get procured from multilateral procurement agencies such as Gavi and others. Gavi, COVAX, CEPI, these are all agencies that are influential in the procurement process. We need to diversify procurement away from the rest of the world into Africa so that Africans are receiving African-produced product. I'm afraid if we don't get that right, building capacities on the continent will be a pipe dream. We will end up having white elephants on the continent. And the next time a pandemic comes around, God forbid, we will be as inadequately equipped to deal with them as we are at present. So the single biggest message in terms of what we need to do to establish local capacities, we need to diversify procurement away from other geographic jurisdictions back into Africa so that we can sustain our manufacturing capacities on the continent.
Thank you, Stavros. Martin Stachel, you have in some similar discussions, you've had to be a bit of a punching bag on for the commission, and but you are always very candid and straightforward, and we appreciate that. And so I preface my question to you with that. But you're the Deputy Director General at the DG for International Partnerships at the Commission, but also at the beginning of the pandemic, you were at DG Sante, and you've seen some of the things that people have described as far as lack of coordination in the multilateral system, but you also saw at the beginning European countries not coordinating with each other, and were you surprised by those breakdowns, and do you think that we can get past them next time around, or is this going to be something that we repeat?
Well, thank you for inviting me, first of all. I mean, no, I was not surprised that this happened at the very beginning, because obviously there is no rule book on something like this. We have to keep in mind that at the start of this pandemic, we were facing a lot of unknowns. I think the situation, initially chaotic, improved a great deal. But I'll come to the title of the very interesting title you chose for this panel, Hope or Disillusion. I would nuance it a bit, and I would say it's actually hope and disillusion. There is actually a mix of both. I would personally lean a bit more towards hope for a few reasons. First of all, I think this pandemic has shown the potential of science. If this pandemic had broken even 5 years ago, I doubt whether we would actually have been able to produce vaccines so quickly. And this also brings a lot of hope for other diseases, some of which are even more relevant to Africa than COVID. Second point is we've seen, I think, after the initial shock, a tremendous mobilization. Certainly, I mean, of course, there's a lot to criticize in that, don't get me wrong. But if we look at what the European Union has done, despite the fact, and this is something we have to acknowledge and we have to admit, Europe ended up being one of the main epicenters of the pandemic. The European region has lost 1.5 million people to COVID. This sent a tremendous shockwave through the system. Notwithstanding, the European Union has committed 46 billion euros to help partner countries address the consequences, 3 billion euros to COVAX. COVAX has been unfairly criticized, but it's just delivered its billionth dose. And this is, I think, again, something unprecedented. And also, we've fulfilled our target to share over 300 million vaccine doses with low and middle income countries by 2021. And we are definitely on track to meet our 700 million dose target by the middle of this year. And we've also launched a very important initiative to support Africa in doing what the previous speakers just mentioned, the importance of diversifying production, which brings me to the most, I think, optimistic result of this. What I've observed, one thing which really gives me great hope for the future is the African leadership in all of this. I mean, Africa has rightly emphasized, the deficiencies in the global architecture. That's true. But also Africa has taken concrete steps to address this. I mean, the central role played by the African CDC was absolutely instrumental in helping Africa manage this pandemic. The steps to establish the African Medicines Agency, the recent declaration by President Ramaphosa about the possibility of setting up an AU pandemic preparedness and response authority. Lots of initiatives. So clearly Africa is determined to take its destiny into its own hands, and we're fully behind that. Now, of course, that's the rosy part. Now, coming to the disillusion, there's a lot, of course, which this pandemic has exposed as structural deficiencies. And we face, I think now, a double problem. And the two sides of this problem are interrelated. First is the global vaccines divide. That is really something which is unacceptable. And we need to really accelerate efforts, not in the coming months, I would say in the coming weeks, to address this. And also linked to that is the issue of the inevitable rise of new variants. And those new variants could be less or more lethal than previous ones. And the two aspects are related, because on the one hand, we know that leaving large parts of the world unvaccinated is inviting the possibility of new variants arising there. But also with each new variant, and we know that the coverage of the existing vaccines also wanes over time. So we will be caught in this really between a rock and a hard place, whether to revaccinate people on the one hand to ensure that the gains made are not lost. At the same time, the need to vaccinate those who have not yet been vaccinated, and we need to do both. So what are the answers to this? We need to do three things. Scale up, first of all, dose sharing, particularly in the coming weeks and months. It also means that when we say we live with the virus, it does not mean that in those parts of the world where there's a high vaccination rate, we should not just abandon all other measures of control, because we have to win time to be able to vaccinate the rest of the world before we get further waves of this virus. This pandemic is not yet over by any means. Second, we need to scale up vaccine production everywhere and diversify that vaccine production. If I could use a simple analogy, it's not just the number of fire extinguishers you have in a building, but also the distribution of those fire extinguishers. We need to make sure that they are all over the building. And therefore, this is something vital. It also means we will have to enter into difficult discussions, but necessary discussions. We cannot just focus on producing vaccines at the cheapest cost, because this inevitably leads to concentration in specific locations. And that is a security risk. And finally, but I'm sure 2022 will bring this out as the major challenge. It's one thing to produce vaccines, to produce enough of them and everywhere. It's another thing then to get vaccines into arms. So supporting vaccine rollouts will expose also the fact that we will have major problems because this is linked to the efficiency of health systems, in some cases, the inexistence of health systems, the weaknesses of logistical chains, and the absence, in many cases, of sufficient frontline health workers to administer the vaccines. Vaccines do not self-administer. And therefore, 2022, we will need to shift attention not just to an industrial problem, how to produce more vaccines, but how to get those vaccines to health systems and to have health systems that are able to deliver those vaccines.
All right. Well, thank you, Martin. You have given me a lot of questions to follow up with the panel, and I'm going to kick it to John in a second. But Martin, I'm going to ask you a follow-up question quickly. You said that we need to do more to fight the vaccine inequality in weeks, not just months. Can we expect new commitments from the European Commission or from Team Europe in the coming days or weeks?
Yes, well, we have to take advantage of the next few months when hopefully, we will be, in a, past the current wave, to make sure we are well prepared for the next wave, because there will be further waves. This virus is not going away. As I said, we are on track in Europe towards sharing the 700 million dose target we have set for mid-2022. The European Commission will directly itself purchase and donate 200 million doses. And at the same time, we are pursuing in other initiatives to also support the delivery side. So working particularly with those sub-Saharan African countries that have the lowest vaccination rate. This is where we have countries which are not even above 5% vaccination rate. We have to focus our efforts particularly there and to move towards the 70% target. And particularly to make sure that, for example, essential categories like health workers and others are vaccinated quickly and fully.
Great, thank you. As I said, John, I'm going to kick it to you. What do you think of what we've been talking about, especially the point that Martin made about the need to make sure that vaccines are actually getting into arms? Is this an issue for the local health systems? Is this an issue for the global community? We heard Gavi say that COVAX can't take new vaccine donations because they don't have the money for syringes. What's your take on the next steps here?
No, absolutely. I think Martin, as always, was extremely articulate with the issues we face. In 2022, our focus must shift from just acquiring vaccines to administering the vaccines. And that will require two things. It will require a very deliberate approach to coordination and a very deliberate approach to partnerships. I think the kind of partnerships that we co-create is very important. What we must avoid is where, say, the EU, just for the sake of the conversation, picks a few countries in Africa and then works with them just bilaterally. We at the African CDC and African Union are saying that, well, you can do that, but let's do that in a way that we can coordinate and understand what is going on, okay? And that way we ensure efficiencies and avoid duplications as much as possible. We set common targets and we work under the spirit of one country, one action plan to get to 70%. I think that is the spirit of 2022. We can get there. We have seen countries like Rwanda, who are really now up to above 55% of their immunization targets, where Morocco and other countries in Africa, Mozambique emerging, and South Africa. So I think we can do that, but we just have to make truly approaches as a program, but rather than, as we've seen in the past, deal with this as if this was some kind of diplomacy that we were doing that. I think we have a unique opportunity in 2022 to do that if we do the right partnerships, the right coordination, as Africa has done in 2020 and 2021.
Thank you. So I realize that our other speakers probably also have reactions, but I want to just move on slightly, and we can wrap things in. So we're 2 days, as we said, from the Africa EU Summit, and a big question from my colleagues, from a former colleague now in our list of questions from the audience. So Vince Chadwick, who's now at DevEx, has asked, and he directs this to Martin Seychelles, so I'll give it to you again. Sorry, Martin, as we said, you sometimes are the punching bag at these. And then I want to hear from everybody else. But Vince asks, how can the EU host a summit on a new alliance with Africa while ignoring the EU's key ask on the most pressing health problem of our time? And Vince is referring to the TRIPS waiver, which is before the World Trade Organization. Europe, the EU is, of course, one of the key opponents to this waiver for vaccine technology. Martin.
Look, we're not opponents. We actually, have engaged in that. We are willing to continue to engage in this important discussion, but let's not have any disillusions. The scale and the urgency of the problem requires solutions that can be put into place now. And we have supported, for example, the WHO Technology Transfer Hub in South Africa. We continue to support that because we believe that is indeed important to effect technology transfer, to ensure that we can also link that with research. But it's really important not to lose sight of the basic issue, which is we need to start getting vaccines to Africa and into arms now, not in 6 months' time, not in 12 months' time, and certainly not in 2 or 3 years' time. And therefore, while it's important to have this debate, we will not shy away from it. We have to make sure that we also use the tools we currently have. And there's a lot of things we can do. And indeed, we see already very important signs. And I fully agree with what John just said. We have to now fully work under the leadership of the African institutions. Africa is much better prepared to deal with this now than it was a few years ago. The African CDC, the African Union institutions, And therefore, we need to collaborate to identify how we can get vaccines to countries. In some countries, we will work with the national health systems. In other countries, we will have to work also with other actors. And also, I would make a plea for very strong coordination also between countries. We are very much at the moment discussing with our US colleagues, for example, how we can work together in Africa. But again, at the heart of this, we need to place the African institutions who have shown they can exercise strong leadership, and they know the context far better than anybody else.
Thank you, Martin. Stavros, do you want to weigh in on this TRIPS waiver question? How much difference would that make for you?
Great. Thanks very much. An excellent follow-up question. And again, I'm going to draw on my historical experience with HIV and AIDS. And Aspen Pharmacare pioneered the first generic antiretrovirals on the continent. We were having very similar discussions at that point in time. RP seemingly was an obstacle. And the problem was solved by getting the various role players around the table and agreeing to move in the direction of voluntary licenses. We're not in a very different situation today or different set of circumstances. There are some similarities. And an RP waiver is really a door opener. I think what really counts in these discussions, if we want to establish the technologies on the African continent that will allow the continent to respond to these pandemics, what is more important is technology partnerships that allow the transfer of the know-how, the skills that are required, a basic thing like understanding where one gets raw materials from to make these products and which are at an appropriate grade. That forms part of the know-how. So, and the intellectual property and having rights to it is one thing, but the know-how transfers are where the real action lies. And I think that's where we need to further develop the discussion. We've got a good model in the HIV model going back 2 decades or so. But none of these discussions, as I indicated earlier, will mean anything unless we get these multilateral agencies to support and procure from local entities on the continent. To date, there's been no clear indication whether Gavi, COVAX, or any of these other agencies will procure from the continent. Mm-hmm. So the RP goes hand in hand with the procurement, I'm afraid.
Mm-hmm. And did you when COVAX was being developed, were you given an opportunity to participate in the discussion?
We weren't, and I suppose it was a bit of a premature discussion. And I think things have evolved on 24 months later. But to John's point earlier, I think the continent has demonstrated through President Ramaphosa and others significant political leadership. And we now need to seize this moment. I feel this is the only and best opportunity we've got as a continent to seize on building local capacities. I'm afraid if we miss this opportunity, I think it will set back Africa tremendously. And of course, a setback Africa is not good for the rest of the world because we need to solve the problem for the entirety of humanity.
Mm-hmm. Thank you, Stavros. Leva, what's your take on this question of local? This is, I know, something you're paying a lot of attention to, how to build up local capacity, engagement with Big Pharma as far as sharing know-how. And also to just kind of make sure that we kick off this discussion about the broader EU Africa Summit, what are the things that you're going to be looking for through the end of this week to make the summit a success? What commitments do you need to see from Brussels and from European capitals? So a bunch of questions in one, but
yes,
I know you can tie them all together.
That's a lot of questions. I don't want to. That's a lot of questions, but when I would look at success of the summit is really to change the nature of a real partnership, really, what John said, co-creation, listen to each other, work with each other, and respect the leadership that Africa has demonstrated so well in the last 2 years. I'm really impressed by this, and I think this is an amazing opportunity for the partnership between Europe and Africa, and it's also an amazing opportunity for. I mean, the good news will be that Africa is showing that it's transforming itself, that's emancipating from dependencies and not creating new dependencies, but Africa and Europe together, we will have to change some of the global health situation. As Stavros said, is very right. The global procurement systems that we set up with Gavi and UNICEF and so have created a market in Denmark for the vaccines in Africa in a way. And if we want to localize production, that market needs also to be in Africa and beyond, of course. So that I support very much that comment from Stavros. And so the commitment together to change the global architecture and to really work with regional organizations and national organizations in Africa is one of the things that I really look forward. And I hear from Martin that Europe is going in that direction, and I'm very happy about this. I would like to also see, not just because we're focusing on health, of course, health is important, but the recovery, I would also like to see an outcome of the summit about supporting the recovery of Africa. The recovery of Africa, I mean, Africa is for the moment putting 2% of its GDP on the recovery, whereas Europe is putting 20% of its GDP, and the GDP is already not comparable. So we can imagine that the 10 years to come will be very hard unless there's real support there and real also with IMF and the World Bank. But I think this should not be forgotten, because so I would see immediate support for African localization, immediate support for vaccines now, especially also for healthcare workers everywhere in Africa, and recovery support I would like to see very much. I would like to comment on one of on the tech transfer. I agree with Stavros about the tech transfer being very important. But if we had a waiver 2 years ago when it was requested and was it proposed, maybe we would have not the threat that is over the head now of the hub in South Africa.
Can you give us a bit of background on that for those who are not paying as close attention to you as you?
Because we have for the moment a very successful production of a vaccine, an mRNA vaccine in South Africa, very recently. And I think that shows that it's possible to do this in Africa, which is a positive thing already, again. But if we had a waiver, we might not have the threat that Moderna would challenge the patents, true patents, production of vaccines there. So this is, I mean, I don't have the solution because I'm not the negotiator, and Martin is right saying this will take a lot of negotiations. This is already going on since 2 years, and who knows, by the time the negotiations are over and a waiver is agreed or not agreed, probably not agreed. But in the meantime, we're possibly undermining some of the solutions in the South, especially for the moment in South Africa. And I think we should be honest about this also. This is, so if the TRIPS agreement is not going to be changed or discussed, or the waiver is not going to further, what is then the proposal that Europe will come up with so that the hub in South Africa will not be challenged by infringement of patent rules? That is for me a question more than and I don't have the answer, but I would like to see an answer there.
Martin, do you have an answer?
Well, yes, I think the answer is delineating itself. First of all, the tech transfer hub in South Africa has evolved tremendously since the original idea. This is not about copying anybody's vaccine. This is about developing, if anything, a next generation vaccine in Africa, which may be even much better suited for the needs of African health systems, etc. So that is clearly the direction that we would like to see. It should be real technology transfer, which means the strong link with research. We have to keep in mind there is tremendous potential also to do this in Africa. Also because this technology can be used also to target other diseases or even a bigger problem for Africa: malaria, tuberculosis, who knows, maybe HIV/AIDS, etc. Second point is, I think we should not think that the industry is that Africa is not capable of attracting the industry on its own steam. I speak to pharmaceutical and medical technology company representatives quite regularly, and they're all looking at Africa. Any CEO in this sector who not looking at Africa with its projected demographic growth and its economic growth is not really looking at the future. That is the reality. So the key issue is, how do we support Africa in its efforts, in its strong efforts to build a business case? And we're seeing already countries like Rwanda, Senegal, South Africa, Ghana, really attracting already investment. So we should not, I think, resign ourselves and say, well, Africa cannot attract investment and therefore we have to find some other way to get. No, Africa can and will attract investment. Our job in the European Union is to support our African colleagues to do just to accelerate that. But the existence now of strong African institutions and efforts towards regulatory harmonization, addressing the skills gaps, etc., initiatives like AVAT and the potential they hold for joint procurement, and
AVAT was the African vaccine
acquisition task force. So really, that is a mechanism which could really bring out the full potential of the African market. So the African market is an enormous market. At the moment, its potential is locked because it's fragmented. There are, of course, issues of affordability. But these are all issues which can be overcome. And bring me to the point made by our South African colleague. It's important to move away from the logic of vaccines and medicines at the cheapest possible price. A big discussion we need to have at international level is we need to be prepared to pay a premium for health security, which means diversifying production globally, everywhere. There should be enough local production so that everyone can deal with the crisis without being overly dependent on other parts of the world. Because in a pandemic, the normal rules break down. The normal rules do not work when everyone has a fire in their house, and then therefore, it's difficult to help your neighbor if you have a fire burning in your own house as well. So building capacity, particularly in Africa, but also elsewhere. Latin America, for example, is another example. Building capacity in regions of the world which are currently not well served by the current business model is a must, and it's the best way to prepare for the next pandemic.
Can you help me understand what you mean when you talk about adjusting to not paying for things like vaccines at the cheapest possible price? Is that something that Europe needs to figure out? Is that something that Africa needs to adjust to? Everybody, and can you help me understand the connection with the current?
Sure. This is in my view very important. First of all, if we say we're going to purchase vaccines at the lowest possible price, that inevitably leads to concentration of production in places where the efficiency is greatest. Now, that's fine in normal times, but in a pandemic situation, that is a big risk. We saw with what happened with India, a large country, very efficient vaccine production, very large vaccine production. When the pandemic hit India, of course, there was an immediate, problem there, because India, of course, needs to meet its own needs as well. So we are, a big part of the global health security debate which needs to happen is how to ensure that wherever we have a distributed production, that irrespective of how a future pandemic or serious local epidemic evolves, we have alternative sources of supply. This will mean potentially being prepared to pay a slightly higher price, hopefully not too higher, as a kind of insurance premium, a security premium. And we need to be prepared to help our partner countries who may not be able to pay that premium to do so. So, African vaccines produced in Africa for Africa. Similarly, other parts of the world, like Latin America, etc. This is a big part of how we can be very well prepared for the next pandemic, so that we are all confident in our neighbors' ability to deal with the crisis, and we can focus on dealing with the crisis at home while knowing that our neighbor can do the same.
Thank you. John, back over to you, back to this question about the Africa-EU summit. You've talked a lot about resetting the multilateral system, about getting more support for regional efforts. As concretely as possible, can you tell us what you want to see as an outcome of this summit? What are the things that need to be in that document or declaration that will make you feel like it actually was a success and is moving us forward?
No, wonderful. If I were writing that declaration, the headline of that declaration will be the EU-AU summit agrees to support Africa's health sovereignty. That means that they should be able to produce vaccines, pharmaceuticals, and diagnostics. That headline will also capture the whole reset button. That means that we really need to look at the architecture that governs us. What does Gavi do? What is the UNICEF doing for Africa? And how can we work collaboratively so some of that capacity and capabilities actually is done within the continent? For example, the instruments that have emerged during this pandemic, like the African Vaccine Acquisition Task Team, how can the AU-EU summit support the operationalization of that so that it goes beyond just the COVID crisis we are discussing there? The African Medicine Supply Platform, that is a platform that emerged, developed by Africans for Africans during this pandemic that must be supported. Those are the kind of very concrete things that I'm looking forward to the summit supporting. So otherwise, we have to move from the academic discussions to the reality and truly find champions, people like Gail Smith, who are on this call, and Live. In my view, some of those agents of changes that we can actually pull them together and they think through these issues and be very courageous, as Martin said, so that we are not afraid to disrupt the current equilibrium and to create what will truly feed into the Africans' health sovereignty. Our global health security, clearly, and I repeat this, must be based on the fact that Africa must do its own things, as Martin said, take care of what your current needs are, such that when there's a fire, you turn off your own fires within your own house so that the next neighbor turns off the fire and collectively we put off the fire. My fear, just to conclude, is that we may come out of this pandemic documenting lessons, but not learning any lessons. We did plenty of that during the Ebola outbreak in West Africa, where if you Google, you see lots and lots of fine reports that were written in 2016 after the Ebola outbreak, even though none of that came from Africa. I think that is a good example of what I would just remind anyone of, trying to solve Africa's problem from outside and not necessarily Africa taking a lead to do that. These crises have shown that Africa knows what it wants, can do what it can actually mobilize itself to solve its problem if enabled. And that is what the EU summit should actually be focusing on. Again, let me end with where I started. Africans' health sovereignty is key if we have to succeed in the partnership between the AU and the EU.
Mm-hmm. John, thank you. I'm gonna ask a follow-up question to you in a very oversimplified way, so please push back. But when you're talking about Europe giving support for African health sovereignty, are you saying you want maybe money, but then the decisions are left to you? Is that an accurate understanding?
Well, it's really, I'm happy you raised that question. I think the conversation that governs the partnership between AU and EU should move away from money issues and actually looking at both political support for the agendas that Africa is championing, and of course, back that up with resources, money, financial resources. And financial resources should actually be looked at in a very broad sense. It's not necessarily for Europe to mobilize billions Africans and hand it over to Africans, but facilitating Africans to have access to the financial markets, like the SDRs that we have been discussing here. So again, that is exactly what I'm referring to. Let's hit the reset button so that the relationship each time is not about Africans coming to look for money and going back, but rather a different dialogue that we have that shows respect. What we at the Africa CDC is championing, we call it respectful, action-oriented partnerships.
Yeah, thank you. Because I think sometimes we hear support and we don't know what kind of support is actually needed. But this is actually a great moment to switch gears a little bit. I'm going to ask you a really interesting question we got from Daniele Fetzibene, who's from ETTG. And Daniele asks, it's moving around on my screen, how can the EU and AU work together to support the newly born African Medicines Agency? How to make it a strong actor able to tackle future pandemics? And can the European Medicines Agency be a model? Who wants to tackle that one first?
Well, I think this is indeed one of the most exciting developments that clearly show African leadership. After the successful experience with the African CDC, now we have the African Medicines Agency taking its first steps as well. Now, that is extremely interesting because it's clear that Africa has chosen a model which is quite similar to that chosen by Europe. So I think actually, Europe and Africa today, are the only two examples of regional models, and that is grounds for an obvious partnership and collaboration. So definitely, the European Medicines Agency stands already fully mobilized to support the African Medicines Agency as soon as it is formally established. It's good to see an increasing number of African countries really coming forward. This is a very important move. Of course, I would like to support this in every way. Our experience in Europe has precisely been, and this is an experience we're very happy to share with Africa, that actually a regional model does not come at the expense of national capacity. Quite the opposite. We have in Europe many of our member states are small or medium-sized, and they have managed to build a national capacity precisely because they can rely on the framework provided by the European Medicines Agency. I am absolutely convinced the same will hold true for Africa as well. And I know from talking to our African colleagues that this is a very key consideration for them. They do not want to build something at regional level at the expense of the national level, but they would like to strengthen both levels. And this is indeed what this model offers. So a big part of our work at the moment is indeed to support the African institutions, including the AMA, through twinning, through capacity building. There's a lot that we can do there. Also to look at establishing common platforms for clinical trials, research. There's a lot that can be done, all of great potential benefit to Africa, and that actually could help channel this growing interest from the pharma industry to Africa, bringing jobs and also a lot of additional economic benefits, not just health benefits.
Thank you, Stavros. How do you see the role of an African Medicines Agency?
I think, firstly, any step that looks at regional aggregation, as you're seeing on the AVID platform, or regional harmonization, is important to creating the capacity that we're all speaking about on this call, right? So if I were to use the procurement analogy for the regulatory agency, it would be the AVID platform, as Dr. John and Nkeda Song said earlier. Creating that type of platform has allowed Africa to aggregate its volumes for the first time. And when you get aggregated volumes, then you have leverage to either produce locally, or in the instance where you do need to procure from elsewhere, you've got that leverage to procure at scale. And of course, the agency is part and parcel of allowing you to achieve that. So it's a very important element. The other thing I just want to touch on very briefly is that Africa has already produced vaccines. So our regulatory strength has been put to the test already. So Aspen Pharmacare, who I'm representing on this call, has produced in excess of 160 million doses of the Johnson & Johnson COVID vaccine, most of which has gone to African patients, and some of it has gone to Europe. So having a a harmonized regulatory agency will assist, aid, and abet the overall objective and John's point around sovereignty for Africa, health sovereignty, that is.
And an interesting reminder that European patients are getting vaccines from African producers. Definitely worth noting. We have about 5 minutes left, so Leva or John, if you want to weigh in on the AMA, you can, and if not, then I will move on.
Yeah, I'll weigh in just to support what Martin and Stavros have said. I think this is a very important agency, and that needs to be really all our efforts during this summit will need to rally behind that agency. I think as someone who has had the privilege and the great fortune of operationalizing a concept, which was the Africa CDC in 2017 into reality today, I know that it's an uphill task to get the AMA to where it has to be. And it requires the indulgence and support of everybody. I think everyone who knows what building institutions is about. It is not for the faint-hearted. It is for all of us to do that collectively. Let me just say that there are a couple of things that I really like the EU summit to sign up onto, and with clarity and not to look away. I'll quote this. Before I list the things, let me just remind everyone what one of the founding fathers of Africa said, Julius Nyerere of Tanzania. He said, one of the worst things with colonization was doing things for the continent without consulting the continent or minding what the continent was thinking. I think to him, it was very painful. So today, the African continent is saying, support us to operationalize the AVAT, okay, so that it becomes a platform that can actually secure more vaccines in the future and help shape the market. Shaping the market is very important. The continent is saying that we have a platform like the African Medical Supply Platform, support us in that. The continent is saying support us to operationalize the AMA. The continent is saying support us to move the Africa CDC to a much higher level. The head of state just 2 weeks ago elevated the status of Africa CDC to a health agency, autonomous health agency of the continent. Support us in that direction. They also endorsed a report from President Ramaphosa to establish the African Workforce Task Team to review the overall public health workforce for the continent and other vaccine manufacturing and diagnostics. If the EU summit can actually rally all of this, capture all of this into the declarations, that I will be pleased. I know that this is a successful conference that has listened to the direction that the continent is heading, has endorsed it, and is backing it there. So without that, I think we'll continue to have an academic discussion.
Mm-hmm. Thanks. And I want to touch briefly on something I tend to be kind of obsessed with geopolitics, and sometimes it's a way to, John, you talked about some of the problems with the geopolitical approach sometimes to targeted vaccine donations. I want to ask though, so China has helped physically build the Africa CDC, if I'm not mistaken. Beijing is increasingly involved in both Africa and in infrastructure in Europe. Do you feel like there are things that Brussels or European capitals could learn from China's approach, or would you like to move away from that as well? John, I'll send that one back to you.
No, absolutely. I think, first of all, to be quite frank with you, doing this job for 5 years, my position is that for Africa has to take its own ownership and leadership. And with the kind of political leadership that I've seen over the last 5 years, especially the last 2 years during this pandemic, they can actually do their own things. That is by building their own fiscal infrastructure and then relying on partners to work with them so that they can make it functional, but not necessarily looking for the EU to build a building for the continent and stuff like that. There's a lot of capacity development that can take place between the EU and AU that is not necessarily around infrastructure building. I don't think raising $100 million from the continent is above 55 member states to build anything they want to build, if you see where I'm coming from. But capacity development is what you really need. The software of that is required behind all the initiatives that I just listed is truly what I'm looking forward to, that kind of partnership between the AU and the EU to drive all those initiatives that I just mentioned.
Mm-hmm. Thank you. All right, so we're pretty much out of time, and I'm going to do something kind of mean, which is I'm going to ask a complex question and tell each person that they only have, let's say, 45 seconds to answer because we're already over. So pretty much all of you are veterans of the HIV fight, which is not over, and we tried to fix the inequities that we were talking about with HIV, but ultimately it seems to me that if countries want to be selfish, they're going to be selfish. Is there a way to enshrine coordination into law? And if not, how can we change domestic political impulses? Leva, I'm going to make you try to do that one first.
Oh, this is too much, too difficult in 40 seconds. I think we should have, there's a lot of lessons learned from HIV. HIV is not over, and I think we didn't learn all of the lessons, we didn't adapt, but the Me Too approach that the countries have now with COVID, or some regions have, especially also in Europe, should be changed by increasing the cake and increasing the sovereignty of the regions, but also the collaborations with the regions. At a certain stage, Europe might need the help of Africa. At another stage, Africa might need the help of Europe. And as we network with each other better, and we respect each other's sovereignty, and we will get there. So my hope is that the summit will go in the right direction.
Thank you. That was very well done. Martin, over to you. How can we...
Yes, I think, if we come to the point where we have to decide between the safety of our own citizens and the rest of the world, the battle is already lost at that point. Our job is to ensure we do not come to that point. And I think there is good reason for optimism. I think, the points that have come out today are indeed what the summit will be discussing. This is about, building Africa's capacity to produce, purchase, and deploy its own vaccines and medicines. Simply put, we need globally to be better prepared for the next pandemic, to be able to produce more vaccines, have those distributed, produced all around the world, and to also be prepared to enter into the necessary discussions on how we pay for that. That is key, and I'm sure that we can do that because now, we have all the building blocks and a lot of experience from this pandemic.
Stavros, to you, can we overcome me first sentiments, either by law or by persuasion? Oh, you're muted. I might send it to John while you.
Apologies. Okay, should I come in?
Yeah.
I said complex to cover in 40 seconds, but there's 2 points. I think the first is I'm not sure we're going to change human behavior anytime soon. So I'm going to sound boring and predictable and say where we need to place a focus and emphasis is in building local capacities. If you do that, then you don't depend on anybody else. You have your future in your own hands. And the second point is I'm not greatly in favor of legislating things and coercing things out of people. I think there's got to be a voluntary willingness here. And we saw that with HIV/AIDS, where we concluded voluntary licenses. So I think we need to take this to a level where we say that a stable Africa is in the interest geopolitically of the world, and we will embark on these voluntary processes to ensure solutions through local capacity building. Thank you.
Thanks. John, last word to you.
Wonderful. I think I'll use my 40 seconds by saying that we need truly to embrace a new global health order that will review some of the structural deficiencies that has become or continue to make Africa dependent on others. I mean, again, my whole concept of Africa's health sovereignty has to prevail. And by doing that, the only way to do that is truly to step back and say, look, The global health architectures that we have in place now, you can date them back to 1947, after the Second World War. About 75 years or 76 years later, isn't it time to review those and actually embrace a new public health order for our collective health security?
All right, thank you so much. So we have really, I think, set the stage well for the discussions that will be happening here later this week. As John said, we need to hit a reset button on the multilateral system, rethink our sense of how we support. It doesn't mean just money. It doesn't mean dictating things from Brussels and Geneva. As Stavros talked about, there needs to be better efforts to make sure that procurement for vaccines for a particular region actually come from that region. Leva has also talked about ways to improve local capacity, to rethink our mindset in Europe about how we support African systems. And Martin, I really appreciated your point about, we might all need to be prepared to pay a little bit more to make sure that every region can actually produce for themselves. So hopefully this will at least lay out a roadmap, to use Brussels terminology, for the declaration that may emerge next week. So with that, let's take a look at the results of our poll, which is from the One campaign. And while we look at those, I will thank our speakers for joining us and forgiving me for going a little bit over. And thanks to those of you who joined us online. Thanks again to our partner One for making this event possible. We always want to hear your feedback. We're always trying to get better. So you can send us a review to live@politico.eu and check our website for updates about our next events. We have some more coming up this year. You can see that at politico.eu/events. I'm Sarah Wheaton. Thanks so much for joining me.